Okay, but electric blanket time is so good.
Electric blanket time is, yes. It's warm today, so it's the weird in between of like, I'm hot, I'm cold, I'm hot, I'm cold.
Right.
Because
Right.
my drafty old brick house cannot make up its mind about what temperature it wants to be today. So
Oh, man.
got my
Yeah.
short sleeves and my heated blanket.
Yeah. So we're all in pursuit of the perfect temperature. So.
Yes.
I think
I told Turner about your panini method the other day.
Yes, I have a heating pad on my back, and then I put an electric blanket on top of me. Look, EMF be damned, because I do not care about.
Look, you only live once, all right?
I live once, and I am gonna live cozy. Okay, so.
After that. All right, let's do it.
Do this. Welcome to Tell Me About It, a podcast by SLPs for everybody. My name is Francie.
And my name is Maggie.
And today we are continuing our kind of hot buttonsy topics. And today we are talking about tongue ties. Everybody and their mom seems to have one these days, according to my Instagram reel feed. So, yes. What's the deal?
Yeah. This is something that we hear a lot. Like, I feel like when I'm out in public and I tell people I'm a speech therapist, I fairly often get somebody saying like, "Oh, my kid had a tongue tie," or "Oh, I was tongue tied as a kid," or what. I feel like that's less common, actually. Like, people our age or older, I don't hear it of them having a history of tongue tie.
Right. I get a lot of parents at like open house night being like, "Hey, will you look at their tongue? I think they're tongue tied," and having to be kind of on the spot with like, okay, let's talk about it.
Yes, and having like, you're right, this is all over my Instagram feed too. Like, it's something that people are talking about on social media a lot.
And I see a lot of different conversations about it regarding things that I don't know necessarily connect to tongue tie, but they're sure making that leap.
Yeah, the amount of things that I have seen related to tongue and lip ties is crazy. Like, it's not just speech sound production. It's not just feeding. It's stuff like sleep apnea and ADHD symptoms that are like, oh, if you're tongue tied, which, like, yeah, there is a logical line that you can draw there. Like, if your tongue tie is affecting breathing and your breathing is affecting your sleep, then your behavior might be different. Well, I'm just giving it a pass in the sense that, like, logically that checks out. But where I get hung up is like, but does a tongue tie actually affect airway and breathing? Because
there's so much.
Based on what I know about it, I don't think it does. Okay, also full disclosure going into this, in the interest of disclosing bias, I am a tongue tie skeptic. I think that it is overdiagnosed and overutilized to explain speech sound issues, but is not actually all that in a bag of chips. Personally.
No, I think I'm in the same boat where I'm like, I just have a pretty measured take on it, because my biggest concern is always function and not necessarily structure when it comes to our tongue, because I've seen people who've had their whole tongue removed and still are able to eat or, communicate verbally pretty functionally. And so I've seen a lot of differences in tongue structure in my time. And so it just makes me a little suspect when people are like, oh, this little bundle of fascia under your tongue is causing all these issues, when I've seen people with a whole array of tongue presentations be pretty functional. So I don't know. I'm just a heavy skeptic.
For sure. And that actually kind of gets into something that we want to talk about later in this episode of structural differences and the role that they actually do play in speech issues, speech sound production. But before we kind of get into that, there are a few terms and like root words that come up in this conversation a lot. So we wanted to take a minute to define these terms just so that we are all on the same page and we all know what we're talking about. So the first one is frenulum. We have more than two frenulums, but we're talking about the main two that usually come up in this conversation, which is your lingual frenulum and your labial frenulum. This is actually something that I learned today from our good girl, the Informed SLP, my one true love forever. who we are again using to get access to some research about this topic. But in one of their reviews, they noted that a frenulum is not even though it kind of looks like a string or a cord underneath your tongue or attaching your lips to your gums, it's actually fascia, which is this connective tissue that holds things in our body in place. So it is a bundle of fascia that is covered with oral mucosa, which is that tissue on the inside of our mouth. So that's what a frenulum is. There's a lip tie would be that they would be talking about the labial frenulum, and a tongue tie, they would be talking about the lingual frenulum.
And specifically, I feel like the tie part of that denotes not the presence of these things, but the length of them. And I think those two things are oftentimes getting kind of conflated when I see this conversation online, is people be like, look, lift up your tongue. Look, you've got a tongue tie. And actually, that's a frenulum and it's supposed to be there. The question is, can you lift your tongue?
Totally. Yeah, which again is like part of what makes me a really big skeptic about all this, is that there aren't really any awesome objective measures that I am aware of, and that from my brief perusal of the literature I have seen, a lot of these diagnoses seem to be pretty subjective. So on that note, the medical term for tongue tie is ankyloglossia. It's got that root word gloss, meaning tongue. Anything also containing the word like lingual or ling is also going to be referring to the tongue. So those terms might come up today as we're talking. We will probably use colloquial terms and verbiage just because it's easier. But yeah, if you're looking into it because you have a young child that you think might be tongue-tied, or if you are at SLP, these are common terms you might hear on the topic. All right, so this is something that we have seen and heard a ton about. But why are we talking about this today? Because there's plenty of things that we hear about all the time and see on our Instagram feeds that we don't talk about on this podcast. So, so yeah, why did you want to, what was something that made you want to talk about this as a topic, France?
I'm seeing a lot of field creep when it comes to the treatment of tongue ties. I'm seeing more chiropractors involved in the treatment of tongue ties, which always makes me a little skeptical and a little suspicious, because I feel like the people who are best suited to help treat a tongue and lip tie would be somebody like a lactation consultant or a dentist or an SLP. And so anytime I start seeing other fields kind of pick up on things that are in the SLP's field, it makes my little like SLP spidey senses kind of kick in to be like, what's happening here? I don't like it. Mm-hmm. So I've started seeing that. It's making me a little suspicious. So let's talk about it.
Yes, I would definitely agree with that. Something else that I feel like I'm seeing online, and I mean this nicely, is a general confusion about anatomy of the speech mechanism. So of our mouths, pharynxes, tongues, lungs, etc., and a general kind of lack of knowledge about how speech actually works. And again, I mean this nicely because like this is why our job exists as speech therapists. Like this is our whole thing. We don't focus on anything else. We only do speech and language, and like that's our specialty. And so it makes sense for kind of the general public not to have a lot of super specialized knowledge about this. But yeah, sometimes I'll hear people make claims about tongue ties and its effect on speech, and I just think to myself, like, that's not how that works. Like, that's not how that sound is made. That's not how, that's not how that would go down. The logic doesn't track. But for someone that doesn't know a lot about it, it may be a plausible reason why their kid is having trouble producing speech sounds or something like that. So that kind of brings us into what we were talking about earlier with just like the general world of structural differences in the speech mechanism. So there can be a wide array of structural differences. And by structures, we mean like literally like parts of your body.
Yeah,
So
there's really intricate anatomy of the head and neck, and we take multiple classes on head and neck anatomy, and it is detailed and confusing, but there's a lot of tiny little things up in and around our mouth and our airway and our, esophagus, which is not involved in talking, but we do swallowing occasionally, and our trachea and things like that. And so there can be structural differences within those. However, the question always comes back to how are those structures functioning? Because I feel like I can see a lot of variation in what can exist in that wide array of normal and or even in the abnormal but still functional kind of range, right? I think I kind of mentioned it earlier, but people who have any type of like oral cancer might have their tongue or part of their tongue removed in order to treat the oral cancer, and they can still do a lot. A lot. Maggie, are you the one who told me that they had a patient who ate a whole steak post glossectomy?
No.
Somebody in my life has told me that story. And they did great.
Yeah, so that is the thing. Like, it's this weird paradoxical almost like situation where yes, speech and swallowing are these tiny, tiny, precise, very quick, rapid movements that are very precise and very specific. However, there is also a wide range of speed, precision, and specificity where you can still get the same job done or the same message accomplished. And so it is this kind of like paradox where it's like, yes, you're so right. It has to be exact and precise. But it also doesn't.
Right.
There's like this wide range of what is possible and kind of like quote unquote acceptable. I will say, I actually saw this video on Instagram the other day of someone who had a massive structural difference. I believe a large part of their palate was missing, their hard palate at the top of their mouth. This can be for a number of reasons. Sometimes it's congenital, the person's born with it. This was an older adult, and so I think they had probably had a surgery, maybe a cancer or something. But it showed them counting from like, it was probably in the 60s because it's got those plosives with the, the air impaction. They were counting from like, 55 to 60 or whatever it was. And they did it without the prosthesis. And then they added a palate prosthesis into their mouth. And when they wore it, their speech cleared up in a way that was unbelievable. And the only thing they did was add the prosthesis. So this is not us saying that structural differences never cause problems with speech, because they 100% do. But my general rule of thumb is that structural differences have to be fairly extreme for it to be the sole cause of a speech sound problem. So I also will hear parents wonder about kids losing teeth, or kind of, because that's normal. Kids lose their teeth and teeth grow back in and braces happen and all kinds of other orthodonture stuff. And like, yes, that may affect their speech for a small amount of time, but it's not going to make them go from being able to say a sound to not being able to say a sound at all, or to suddenly making a bunch of speech errors that they weren't making before.
I think about how people who get retainers for the first time, specifically the Vivera, like the Invisaligns, or even the old school wire ones. Oh my gosh, my mic is falling. I think about how for the first few weeks that you have that, you're lisping. I can attest. I went through both Invisaligns, and then I also had a wire retainer for quite some time. And for like the first 2 weeks, I'm lisping, but your body learns to compensate. And then when you take the retainer out, you can go back to speaking as you had before. And so it's your ability to like compensate for those differences too that the body's really good at. So once again, not all structures are not all structural differences result in speech errors. However, they absolutely can, and they absolutely do.
Mhm.
This specific example of tongue ties, I'm going to say doesn't, well, we know because the research says does not impact speech. However, it does impact feeding, specifically breastfeeding in infants. And so I think that's where a lot of people don't understand the difference between feeding and speaking, because those are two
Mhm.
different kind of, we've had that conversation before when it comes to apraxia, with
Yeah.
the differences between, like, you're using the same muscles, you're using the same area, but you're accomplishing two different things. So why are they motor planned differently? Right. I feel like that's kind of true for this kind of conversation with tongue ties, and how we can have a structural difference that impacts feeding but might not impact speech later, if that makes sense.
Yes. That does make sense. And it very much goes back to kind of that conversation that we had about oral motor apraxia versus apraxia of speech versus a feeding disorder. Even though these are all the same muscles, the same musculature, sometimes even the same movements, they are different because speech is unique and speech is different. The last thing I will say about structural differences too is that it depends on what the issue is. So if I had a parent come to me and say, like, my kid has lost a lot of teeth lately, and I think they might have a tongue tie because they can't say their R sounds, I would say R sounds, generally speaking, have nothing to do with that. I don't think, like, we don't use our teeth to make an R. We do use our tongue, but it's the back part of the tongue that is not, you would have to have like paralysis or significant loss of mobility in the tongue to not be able to make that sound. Something that I think your kind of like run of the mill tongue tie would probably not get you, especially for an older child if we're talking about a kindergartner or first grader. So it's kind of like it depends on what the issue is, and the hypothetical structural components that may be impacting it. But yeah, speech is crazy. It really is just all these like teeny tiny little movements. We get so fast and so good with it that we don't even think about how amazing it is. Okay, so that's kind of like why we're walking into this discussion. We are hearing about it all the time. This is a really big topic right now. But what does the research actually say? Francie, you said that one area where this does come into play in a legitimate way is with feeding in infancy, specifically breastfeeding. So do you want to chat about that for a little bit?
Yeah, I can talk about breastfeeding. I think it's important to note too, in the article, once again, we're referring back to our lovely lady, the informed SLP, the statistics that they had on occurrence of, or like prevalence of breastfeeding difficulties due to tongue ties overall was like 3%, which is by and large really low. So if you're experiencing difficulties with breastfeeding, I would be hesitant to jump first to tongue tie because of how low that number is. So I thought that was really fascinating because I did not realize it was that low.
Yeah, and that was the overall prevalence of breastfeeding difficulties secondary to tongue tie. So not the overall prevalence of breastfeeding difficulties.
No.
It's
Breastfeeding difficulties due to tongue tie. And interestingly, another statistic that came from the study was that breastfeeding problems showed up in only 49% of parent-child dyads where tongue tie was present. So even if you do have a tongue tie, even if your infant has a tongue tie, only 49% of people will experience feeding difficulties with the presence of a tongue tie. So it's not every tongue tie either.
Yeah, that Francie, you keep kind of coming back to function and talking about how important that is. So if you want to like kind of speak on that in regards to just because I feel like your perspective on it is so interesting, but yeah, it's if you even do get diagnosed with ankylosing or whatever, you have a really long frenulum, you may not have any impact on your feeding or speech.
Yeah. No, it truly comes down to, yes, you might have a structural difference, but how are we moving our tongue? Is that child able to make that kind of stripping pattern that we would want them to be making to be able to suckle, right? And get the movements that they're needing to. If they do have a tongue tie and that tongue is not moving in the way that we need to, that's a point that I would be concerned about things. When I have kindergarten parents ask me, like, oh, hey, they have a tongue tie, like, do you think that could be impacting their speech? It's oftentimes I'll give it a listen, and if they sound fine, I'm not worried about it. Or if I ask them to lift their tongue up to behind their teeth, where I would expect them to be able to make an L, a T, and a D, and they can make it there, I'm not going to worry about it because they're making everything that I would expect them to, and they're functioning even in the presence of a tongue tie. And I don't think a frenectomy, right, or the clipping of that fascia would be necessary in that moment, right? And so it's a very case by case thing. And to me, the question always comes back to, how is the child functioning? How are they functioning? And if it's impacting breastfeeding, if you are in that 3%, oh my gosh, do what you need to. However, that is we talked previously about differential diagnoses. And if you're experiencing breastfeeding difficulties, it might be worth exploring other options before immediately jumping to tongue tie because of how small that prevalence is, to be able to get the treatment that you need to be able to get your infant to feed properly. Talk to a lactation consultant. They're the loveliest people ever.
Yes. Yes. And I will be the first to admit that as an SLP, my area of expertise and practice is nowhere near feeding or lactation. I do know some SLPs that is their specialty, and that's awesome. I refer out to them because that is not my training. That's not my area of expertise. So I hesitate to even really speak on this so much, other than what I've, learned from continuing education and reading research and stuff. But yes, something that you said. Oh, and now I've totally lost my train of thought. I hate it when this happens. Something that you said made me think of I want to bring this up too. I want to talk about that. Oh, okay, that's what it was. So yeah, a frenectomy, that removal or kind of clipping of the tongue tie of the frenulum, the lingual or labial frenulum, is a procedure.
And it's not without consequence. I feel like a lot of times, is this where you're going? Not for Rita?
That's where I'm going. Yeah,
no. Okay, you take it, girl. Take it.
I was just gonna say, this is something that maybe is presented to parents or to other professionals even as kind of a procedure of no consequence, when not only is that not true, we also have to think about the impact that's going to have on the kid. And if it is an infant, yeah, it is true that they're not going to remember that procedure, but putting a tiny baby through a procedure that is going to cause them pain and discomfort, and may just be something that it's likely not life-saving if they are, because sometimes little baby infants do have to go through really painful procedures for life-saving reasons early on in life. But yeah, something like a frenectomy is not, from what we can tell in the research, usually the difference between life and death. Again, if it is to the point where they literally cannot feed without it, then that's a different story. But yeah, everything is packed in so tightly in that oral cavity. There are nerves that run really close to that. There are muscles that operate the tongue that run really close to there. So getting something and of course the people that are doing these are qualified professionals, but it's still a minor surgery. It's not without risk.
I know. I think I oftentimes see them being presented as, oh, it's just no big deal. We'll just go in and clip it. And
almost like it's getting your ears pierced or something.
Oh yeah. Or something that's very casual.
Yeah.
And ouchies, that's what I say. And it's not without risk too. There's another study that we found in our research that showed that there were more negative impacts than expected, right? It could have been oral aversions, or they were very uncommon, but there's still risks that you have to consider if you're going down that path, right? So
yeah,
I feel like it's presented as without risk or very low risk, and low risk does not mean no risk. So
yeah, which ultimately, yes, if we're comparing this to something I don't know, a heart surgery, yes, of course it's low risk, but it is not no risk, to your point. So just something else to consider when you weigh the pros and cons of health decisions. Something else that we chatted about was functional differences. So we talked about the importance of functional impact. So even if a kid has a really prevalent frenulum that would maybe make you think like, oh, they've got to have some kind of, like, they must be tongue-tied, right? Maybe not. If they have no functional impact, then leave it alone, leave them be. They're operating fine, they're gaining weight, they're intelligible, great. On kind of the flip side of that, functional differences could be due to something else. There's a lot of reasons why our motor movement and the function of our oral cavity can be different or disordered. So things like neuro impacts, something going wrong in the brain, a muscle weakness caused by some kind of neurological event, that would be very extreme, like a stroke or something else like that. General muscle tone differences, and even things like motor planning. So even a little baby that is having feeding difficulties, it could be due to the fact they're having trouble motor planning that suck, swallow, breathe pattern that we want to see. And again, I am not a feeding specialist, so that is all I will say on that. Do not ask me any follow-up questions. I don't know the answer.
And I think, interestingly too, a lot of the research, and Maggie, you could speak to this, is showing that speech deficits are not differences between the presence of a tongue tie and not a presence of a tongue tie have no outcomes on speech intelligibility.
Yeah. Okay. So there was this review, again, on the Informed SLP, our main girl. Oh, by the way, the breastfeeding and tongue tie review on the Informed SLP that we are referencing is free to share. So we will link that in our description. So if you want to look at what we're looking at, go right ahead. This one is free to share. The one that we're kind of changing gears and talking about, though, is called Talking Tongue Tie, Do Tongue Ties Affect Speech? And this is a review on the Informed SLP where they talk about a specific article that came out in 2020. This one, unfortunately, is not free to share. So if you want to read it, you're going to have to buy a subscription to the Informed SLP. But yeah, they are going over this one article that, again, was published in 2020 that looked at 3 groups of children aged 3 to 5. And these 3 groups were kids with no tongue tie, so they had no previous or current diagnosis of tongue tie, untreated tongue tie, so kids that did have a diagnosis but had not had surgery, and then treated tongue tie. So children who were diagnosed with tongue tie as babies, and it says by a dentist and lactation consultant, who had laser frenulotomy as infants. So that is that kind of clipping of the tongue tie. Clipping, I guess, is probably a bad word because this is done with
probably
a laser.
Old school. Yeah, this is probably a little bit closer to burning ?
Yeah, probably. But what's crazy about this, the findings of this study, were that these 3 groups did not differ on speech sound production, intelligibility, or tongue mobility, which is the big 3 things that we hear concerns about as speech therapists and see stuff about online a lot. The 4th thing that they did not differ on was tongue tie diagnosis using the measuring tool that the researchers reported is the only tongue tie measurement tool designed for children aged 1 year and up. So the researchers then took these kids that came in, took the reported history, and then applied this measurement tool and found that the children between the different groups did not differ on the results of using that tool, which is crazy because 2 of these groups had in their medical history a tongue tie. So it's absolutely wild that when then measured kind of independently using this kind of objective tool, there was no significant difference between groups. It does note that the groups did differ on history of attending speech therapy. So kids that had treated tongue tie and untreated tongue tie attended speech therapy. None of the children in the no tongue tie group attended speech therapy. Again, remember, there was no difference in speech sound production or intelligibility between these groups. So why were the only kids that were seeing speech therapists were the ones with tongue ties? That's kind of crazy to me. In fairness, this is one study that they are referencing here, but for me, those results are pretty interesting, pretty significant. It would be great to see other studies replicate these results so that we can kind of see repeatability, and that adds to the reliability of these findings. But I mean, Francie and I off mic, we were talking about our kind of conclusions of this study, where going in, I think my hypothesis would be that the two tongue-tied groups, the treated and untreated, but both been diagnosed with tongue ties, we would see some difference in speech intelligibility and tongue mobility, but there was no difference in that at all. And yet those kids still attended speech therapy while the other ones didn't. So very intriguing. Definitely adds some points in my kind of skeptic bucket of, I think that this is being blown out of proportion a little bit as far as speech sounds are concerned.
Mm-hmm. Agreed.
So what do we do with this information?
Right. I don't know, from my least restrictive environment standpoint, right? And I have a very school brain when it comes to therapy. I don't have a private practice brain. To me, I would fear over treating a child or over identifying and taking them out of their class time for things that they might not actually need to be successful. And that's for every school clinician is kind of like a situation, because you always want kids to be in their least restrictive environment, and pulling them makes that more restrictive. So as I think about things in a kind of a whole child basis, that is definitely something I'm going to consider when people are like, I think they're tongue tied. Well, let's listen to them and let's actually assess what they need.
Mm-hmm. Yeah. I think that is a great point, especially coming from the school SLP perspective. As a private clinician, frankly, I'm happy to do these kind of quote unquote fine tuning, or maybe it's not cosmetic in that it's not aesthetic, but it's if it's a 4 or 5-year-old that can't say their R sounds in the school, we would say they don't qualify. They need more time for it to develop. In private practice, I would say, okay, we can work on this if you want to, it's something that, that's still fine to do. I can still teach the sound, no big deal. I would absolutely explain that, we could give it a couple of years and see if they develop it on their own. But I think this very much falls into that bucket. I would not ethically feel comfortable recommending speech therapy, recommending a frenectomy to a family. Definitely not in order to receive speech therapy. And I also wouldn't use it to justify not receiving speech therapy either. I think that especially the results of the study that I just talked about regarding speech sounds, I just don't think that there's clear evidence that it makes that big of a difference. So we can't justify, especially a surgical intervention, to families that are looking for answers. I think there's many avenues to be tried before jumping to that, even in the private practice setting. Something else that I think that knowing who to talk to about this is also very important. You mentioned a lot of what did you say? Practitioner bleed or something?
Oh yeah, scope creep.
Scope creep. That was such a good term and phrase. I really like that, scope creep.
Yeah, I think making sure that you're going to somebody who has really good knowledge of soft tissues in the head and neck. That's going to be a lactation consultant. That's going to be some type of dentist. That's going to be an SLP.
And ENT too.
An
Your nose and throat doctor.
Yeah, an ENT would be a great one too. Somebody who knows about soft tissue and the range at which it appears to be normal and or abnormal would be the best point of contact if you have questions about that.
Mm-hmm. This is going to be Maggie's spicy hot take for the episode. Do not go to a chiropractor with this. Guys, just don't. I'm really sorry to any chiropractors listening. Unfortunately, I do not agree that this is within your scope of practice. And I think it is coming off a little bit money grabby to like, for chiropractors to offer, especially something that like with the intention of treating a speech sound disorder, to say that they can work on tongue ties kind of with that end goal in mind. I feel like that is inappropriate for chiropractors to be doing. That is not within their scope. And very strange. I'm very suspect. Very, very suspect. I think that chiropractors can do a lot of things for people. I know lots of people that have had very positive interactions and courses of treatment with chiropractors, and that's great. I'm not trying to like take away that lived experience, but as far as claiming to treat speech sound issues, I'm gonna put my foot down and say that is actually not your job, but thank you so much. That's my spicy hot take. But yeah, yes, someone who knows the soft tissues of the mouth really well.
Short and sweet today, huh?
Yeah, yes.
Are you thinking about something spicy? Are you going to say?
It's a little bit. This is the thing I said I wasn't going to bring up earlier when we talked about it. And then now I'm like, I don't know, should I bring it up?
Do you want to get it out? And if we hate it, I'll cut it.
Yeah.
Do it.
Sometimes kids just have speech sound disorders. There's not a clear reason why. We don't really know, like even as specialists in this field, we don't really know why things like articulation disorders, certainly childhood apraxia of speech, these things that are just developmental, we don't know why they happen. And that is tough for a parent who is looking at their child whom they love and they want the best for. It's really hard to hear, we don't know why this is happening. So I think tongue ties present this kind of like nice, neat little answer for why a child is struggling to communicate clearly. And unfortunately, I just don't think that it's actually that simple. I think if it was, you and I would both be out of a job. So that's another thing I don't want that to come off meanly or in a way that, any bad way. I want it to come off good.
You mean this with love and light?
I do mean this with love and light, but sometimes kids just have trouble. They just do, and we don't really know why. So yeah, that's kind of the last thing that I'll say about tongue ties.
Yeah.
That wasn't too spicy, was it?
I don't think that was too spicy. I think it comes down to like, if you have questions, talk to an SLP, talk to an ENT, talk to a pediatrician, talk to a lactation consultant if you are having questions about your child's frenulum. Yeah.
All right. Well, that's that on tongue ties. And yeah, again, this is kind of a installment in our like hot button series. If there are other things that you are seeing a lot on social media or hearing a lot kind of in your workplace or among other parents, let us know, because we would love to chat about that as well. But in the meantime, we can be found on YouTube at Tell Me About It, an SLP podcast, and on Spotify under the same name. You can also come hang out with us on Instagram at Tell Me About It SLP. We will see you next time. Goodbye. Bye.